get my kit prepared. So for me, I just basically put on my pants. You put on a patient on the side of the gurney, wherever you want to keep it. And prepping it. You may do the iodine bit, but part of this is also getting the skin desensitized. And notice how as I'm pushing it, I'm milking out the vein. See how it empties?
Oh yeah.
And lets it fill up again. So that gets the skin basically like distracted, if you will. Alrighty. So now we're going a little 2x2. I put it up somewhere. Just in case I blow it, you always have a backup here. And you would have tape. So with this here, we just have a short 14. I want to make sure the bevel is up. You filming okay?
Yep.
And it's a good trick, especially in the old gel codes, if you just want to rotate this. Don't slide the catheter on and off. Because if you do that, you shear the inside and you can actually cut off slivers of the coat. So I might rotate this just to make sure it's free to advance. Then, once I pick my vein, I will apply traction pretty far back. The reason is if I'm really close, I've got to come in a really steep angle. I'm coming over a hill. Imagine it landing an airplane in a valley. So I'm going to pull it back as far as I can and see how shallow my needle is. The big thing is once I've got my stick here is I just want to poke it here and you'll feel it. And I look for the flash. And so let's see if I poked right through here. I missed it on the first pet, so I'm going to scissor it back slightly. How's that feel so far?
That's
okay. And I'm feeling with my finger up here where the vein is. And I'm pulling it out a little bit more. And this is a part where if you're in the hand, you have to be super shallow. Great, the one time I misaligns me in class. There we go. No. Yeah, exactly. You guys are cursing me. The Grillo curse. Okay. So I got nothing coming out here, so I'm filling the vein here. And each time pulling and stabilizing, you let me know if you're okay.
I'm fine.
All right. What I'm doing, you kind of see a little bit of.
I'm realizing that my veins roll down.
It's not even rolling, but I could feel it now this way. So I could eventually get this. I want to pull it back enough. You can see the tip. This is a short catheter. So I don't come out of the skin. But if I just redirect it inside, I'm just kind of shoving stuff around. So I'm going to pull it back, feel the vein here, and it's a little bit of guesswork here. There we go. So I've got the flash. This is kind of the tricky spot. As I get the flash, I want to slightly advance it and now see if I keep it. See how I kind of pull it all at the same time? Now remember I told you about occluding this? I want to pinch this hard and I can feel the tip on these ones here. Pop that, pop the catheter, and now I would get the eye line. I'm going to simulate this because we don't have a confirmed solution. And attach this and secure the rest. Can you get me the paper towel real quick? I want to see if I'm still in there. I want to fold it up so I can fit it on the edge.
Oh, okay.
Just like we did before. I want to see if I'm actually in place or if I pulled another Grillo. If I let off here, this tells me I'm in the vein. Okay? So right now, if this was a serious situation, like a combat situation, tactical medic situation, where you don't care about making a mess, okay, just let it run. You'll make a sticky mess, and you're not going to be able to use something like this. You're going to have to like tape it circumferentially. Okay, but in a normal, clean, controlled setting, this is all I need to do to know I'm in the vein. There's only one way that I'll get blood flow back if I'm not able to flush and confirm. Make sense? So at this point, it's all set. Now when I want to close it off, I'm going to basically pull the catheter. Notice I'm using my fingers in like multiple ways here. And clean off, and we'll just tape this over. Yeah, or I could use right here. Basically stretch this over, pin it, and keep stretching it and then reinforce it. If you ever do this on someone who's taking Coumadin or whatever, be prepared to put dressings on there. They'll bleed forever.
Even alcohol too.
Yeah, so for the camera, I've got decent veins. He's forking actually the other way. Notice my valve right there.
Hey, assist.
Can you see it right here? See how it's like a lump? And now if I let the blood go, I might run into problems advancing the catheter in this one. So I'd maybe want to go distal to this or proximal to that one. And he's got a little scar there, but I can go up here and look, the vein is pretty much clear. And I can go really far here, and this gives me plenty of room. See the vein, how it's collapsed? And I let it fill. So because I've been playing around with that so much, I'm going to clean it one more time. Don't worry, your chance of actually getting phlebitis from anything other than just irritation of the vein is minimal. So, notice I'm pinching the vein distally, right? And I'm going to poke it right here and advance it slightly. See right that?
Flash.
Now you see how angled, like how shallow I was? And I went between the fingers because it gave me some depth, okay? I advance it a little bit, and then let's see if I can continue. And the catheter tip should be right out there. So I'm going to show you something. Can you get it, or leave it right there for a second. Do not pull that. Confirming placement. I'm going to show it to you. So I pull this here. Now, if I want to see if this is in, I can do this. Oh, it looks like I might have blown it. Tilt your hand down a little bit. Looks like I may not be in. This should, oh, there I am. It's positional. This is one of the things about IVs in the hand, is that they're positional a lot. You'll have to adjust that. But this tells me I'm in. If it was not in, it wouldn't have bled at all. You guys got that?
Yes, sir.
I'll just pop this up this point now that I know that. And I take my line here and take this off, set it, put your hand down on the mat, lock it in. Now I'm confident this is in, so I'm just being prissy and cleaning that. And now I'm going to, and we know we're good. Okay, so this is good. Take this off. Take this little bit here, because it keeps it kind of in a ramp position, if you will. It kind of lifts it a little bit. Put the toilet seat on, which is also good for GSWs and stab wounds and puncture wounds. Are you okay?
Mm-hmm.
I can give you a fluid pulse if you want.
Little
Okay. And Zavala's got your 6. And what I do here is just a little hinge tape.